Thank you so much, Shannon, and welcome everyone. Before I get into the rest of the presentation, a little musical interlude here. All right. I wanted to play that to wake us all up a little bit. I know it's the afternoon, but I really appreciate you being here and hope you enjoyed that little musical bit from It Takes Two, Rob Bass and DJ Easy Rock. Okay, so I'm Lorin Jackson. Like Shannon said, I'm the executive director for the Region 2 Regional Medical Library. No worries if you don't know what NNLM stands for. I'm going to explain that to you in a moment. So for today's presentation, I'm going to give you the top 10 things to know about the Region 2 Regional Medical Library. Let's start with number 1. So the first thing is the network structure. The way that it starts is at the top with the National Institutes of Health. That is our nation's research agency with 27 institutes and offices throughout the country. And then beneath that is the National Library of Medicine, or the NLM. So we have the NIH as the National Institutes of Health, and then the NLM, or the National Library of Medicine. That's the world's largest biomedical library. Underneath that, we have the NNLM, which is what we started off kind of saying on that first slide. That stands for the Network of the National Library of Medicine. That program of the NLM has 7 different regional medical libraries, of which Region 2 is one, and also offices and centers. Sometimes we refer to those as ROCs, or you'll see RMLs referred to mean regional medical libraries. And that brings us to the last part, which are the different RMLs throughout the 7 areas in the country. And those offer education and funding opportunities to support the overall mission of supporting equal access to biomedical information to everyone. So what are the different places that are a part of Region 2? Well, with this new cooperative agreement for this 5 years, we established a new region with Region 2 with the headquarters at the Medical University of South Carolina in Charleston. But our overall service area for Region 2 includes Alabama, Florida, Georgia, Mississippi, the Commonwealth of Puerto Rico, South Carolina, obviously, Tennessee, and the U.S. Virgin Islands. The third thing I wanted to go through from the top 10 is who we are. So we have 3 primary teams that form our regional medical library in Region 2. That includes our advisory team, our administrative team, and then our strategist team. And just as a little fun anecdote, our mascot is an alligator. So you'll kind of see that sort of throughout our presentations or with some of our swag that we make for our region. And so that's our go-to. There are gators throughout, all parts of our region. So that's kind of one way that we have some team identity there. So let me introduce you to the different members of the team. For our advisory team, these are the folks that were a part of our hiring of this entire regional medical library, as well as folks that kind of guide us and steer a lot of the work that we do in the RML. So we have Shannon Jones, of course, who is our director and principal investigator. We also have Heather Holmes, who is our program advisor and associate director for the larger MUSC libraries. And we have Monique Hill, our health literacy and partner engagement advisor, who also works in hands-on health with the MUSC libraries. Let me introduce you to our administrative team. We have Erlnisha Lumpkin. She is our program assistant. Isaac Sherry is our grant administrator and office manager. He is also the liaison for the U.S. Virgin Islands and supports with the Commonwealth of Puerto Rico. And then myself, right, as the executive director, I'm the liaison for Mississippi and the primary contact for the Commonwealth of Puerto Rico. Let me introduce our strategist team. So we have Sarah Fisher. She's our community engagement and outreach specialist right here. Then we have Deanne Brame over here, who is our technology and innovation strategist. She's also the liaison for Georgia. Sarah is the liaison for Alabama and South Florida. Down here, we have Elizabeth Roth. She is our research and data science strategist and our liaison for Tennessee. And we have Deborah Trogdon Livingston right here, our user experience and education strategist, and also our liaison for South Carolina and North Florida. So really with our state liaison breakdown, it's to support with our members throughout those different regions and the different programming that happens throughout our region have a primary contact person that they can get in touch with first for any kinds of questions or, any support they might need for their individual subawards, which I'll talk about in a moment too. So we have 3 larger national NNLM initiatives that we really try to connect with through a lot of our programming and what we do in the RML. So the first one is confronting health misinformation. This is a wonderful tie-in to Dr. Nicole Cook's keynote from earlier today, if you were able to attend that. I do believe it was also recorded if you missed it. But, in that presentation, she gave us some wonderful context and understanding about misinformation, disinformation, and malinformation. These are all hot topics for the larger NNLM initiatives and something that we're trying to confront as well. We also have bridging the digital divide. That just means making sure that people have access to digital literacy and understanding how they can use digital resources in the best way, primarily to increase their access to health information. And then we also have environmental determinants of health. These are just all of a holistic way to think about the ways that we engage with health and how other sorts of environmental factors impact our ability to be healthy or have access to healthy resources. The 5th thing I'll go over are our core values. So recently, as a staff, we did a retreat within the Regional Medical Library for Region 2, and these were some key words that we all agreed on or that came up through that experience that we really try to focus on in our region. So I thought this was kind of helpful to see some of the things that stand out or make our team unique. So we focus on collaboration, integrity, inclusion, compassion, diversity, respect, equity, flexibility, honesty, and work. Those are the main things that we really try to focus on together. So I thought that was helpful. If you haven't met us before, that kind of captures a lot of our essence, I think, pretty well. So one thing to know is that our year is structured from May to April every year. So for year 2, it goes from May 2022 to April 2023. Year 1 was from May 2021 to April 2022. And so this is a picture from one of our other retreats as a staff in January of 2022. But these are our major focus areas for this year. So we're focusing on emergency and disaster preparedness, which I'll talk a bit more in a moment about. We're working on strengthening our governance structures, which I will also tell you more about. We're increasing our exhibitions and conference travel so that folks can get to know us in Region 2 and understand the work that we do. And then one that I am definitely thinking about a lot is our summit that's happening next week. So on August 9th and 10th, we have our colleagues coming from all over to Charleston in order to meet for about a day and a half to talk about, how we can work better together, what it means to work together in this environment with the pandemic, and, making sure that we have some simple rules for how we can engage together as a team. So that is happening. MUSC is hosting. There's a ton of people that have been supporting that effort. And I'm definitely on that committee. So we're very excited to host our colleagues just next week. Our program model really matches our staffing. So, when I walked you through who our strategists are and their different areas, our program model really mirrors their work areas and their titles. So we have membership and outreach as a major focus of our program, funding, which I'll talk about a bit more in a moment as well, governance. So we have a governance structure with 4 different groups that I will also tell you about in a moment, educational programming and support. Technology really frames so much of what we do, especially because of needing to connect with people virtually. And then, of course, assessment and evaluation to make sure we're doing our due diligence and have data-informed approaches to the way that we run our program. So let me give you some conference highlights for what's going on this year as a major part of our membership and outreach plan. Really what frames most of our conference work and exhibitions and what we do are centered on our high value communities and key demographics. So the people that we try to really connect to, that connects to our proposal, are minority health science professionals and healthcare workers. We want to support Spanish language speakers in exhibiting or wherever we go. For rural community members, so folks who are in our service areas, who live in rural areas, are definitely a focus. We have a public health focus. So, while it's very easy for us, and, my background is in libraries, I'm a librarian, we need to expand our work to connect with public health workers. And then, of course, focusing on developing health literacy in alignment with digital literacy. So thinking about things like telehealth or, accessing work through portals when you need to be able to connect with healthcare professionals. These are things that we want to make sure we're addressing for our membership. Some places where we're exhibiting in July, 2 of our members of our team, Deanne Brame and Sarah Fisher, visited the National Black Nurses Association. They had a 50th anniversary conference in Chicago. The 2 of them were able to go at the end of July to that. In October, our whole team will be at the Southern chapter of the Medical Library Association. We're very excited about that. And actually, the program chair, Emily Brennan, is also a member of our MUSC Libraries team. So we're very excited that she's taking on that leadership. We also will have a pretty strong presence at the Joint Conference of Librarians of Color Conference, which will be in Florida, which is also in our service area. So we're excited about that. That's in October. And then in March, looking forward, the South Carolina Public Health Conference, 100th anniversary conference, we are planning to exhibit. You can see some of the other places that we are interested in going and that we're planning to go. They're on the other side of the screen there next to exhibitions. Let me talk to you a little bit more about funding. The states so far that we funded in year 2 include Alabama, Florida, Georgia, South Carolina, Tennessee, and the US Virgin Islands. You can see here the different types of awards and about how much we've given. One of the things to know about subawards is that, we have a larger award, which is how we're funded, how we are run, how our salaries are paid. But then part of the structure of the network of the National Library of Medicine, NNLM, is to provide subawards to, primarily community-based and faith-based organizations, but also colleagues that work in other health sciences departments and universities and things with grants for projects. So this is how it breaks down. You can see the type of award that is most popular is health information outreach there in the middle. I want to tell you more about our governance boards. One of them is the Emergency Response and Preparedness Advisory Committee. This one, the abbreviation for that is ERPAC. That's often what we call it. Our chair is Sarah Fisher from our team. You can see some of the things that they're working on, but we're really excited for webinars in the fall that are focusing on our year 2 focus area of emergency response and preparedness. We also have our regional advisory board. Co-chairs of that are Shannon Jones and myself. With that group, we work in different working groups in between meeting on things like our charge overall, science and data, education and intellectual freedom, DEI issues, and healthcare equity. So the about 10 or 11 member board kind of breaks down into those smaller working groups to work on smaller projects that help us address our overall goals and also give us guidance for Region 2 overall. Other governance boards that we work with are the Consortium of Southern Biomedical Libraries. Many of you might be familiar with that group or be on it, actually. Our PI, Shannon Jones, is primarily responsible for that, but she also works in collaboration with the Combles chair. We're excited to meet with them in the fall to talk about the resource library program and revamping it. We're getting a lot of positive input from folks who have worked as resource libraries or know about it in Combles. So we're very much looking forward to that. Thank you, Shannon, for coordinating that future talk. We also have the Health Literacy Advisory Think Tank. The chair of that is Monique Hill. Their kickoff meeting was in March, and they're really working to address the initiative of Healthy People 2030 and then overall guiding and supporting our work as well with the members of that team. Other aspects of our program, again, are education and programming. So I have this quote from a colleague from the American Library Association, which I think does a really great job of saying that, expanding health literacy is important to everyone. Just because we might be not as knowledgeable about health literacy doesn't mean we're not intelligent. So we provide monthly educational offerings. We want to continue with emergency preparedness in year 2 by hosting, and I mentioned this a little bit before, but 2 disaster preparedness webinars in September, focusing on on disaster preparedness and underrepresented populations specifically. Sarah Fisher is really leading the charge on that. We're also providing 4 Tech Talk webinars throughout year 2. Deanne Brame is our point person for that. And then we use survey data and responses to improve and really work on our education plan, which all of us really contribute to, but Deborah really leads the charge on that. And then we want to maintain and expand an equity focus when selecting themes and experts for the programming that we provide. This is just a quick snapshot of our year 2 class schedule for, different class offerings that we have in Region 2 for year 2. So you can see where each of the members of our team as strategists are the additional instructor or whether the lead instructor for these different courses. Please let us know if you're interested in these or want to get connected to them. We'd be happy to give you more information. Regarding assessment, we are completing and working on an environmental scan to survey members, and we're using the NNLM's National Evaluation Center to support us with that. And Elizabeth, as a member of our team, is really leading that because of her subject area. We want to simplify language on our grant application, continue to assist subawardees with evaluation because that can be very difficult and sometimes is a learning need for us, but then also for the people that we work with as members. And we want to continue to collaborate with our regional advisory board to support them with data and evidence-based practice, which we know is a best practice. All right, we're nearing the end. We're at number 8, communication. We are working on updating our communications plan in year 2, making it even better than what it was in year 1. We have a standardized internal newsletter and external monthly newsletter that anyone here can sign up for, and I'll tell you how to do that in a moment. And we have a semi-regular digest. I'll explain what these each are in a moment. Also, we solicit member feedback through communication channels, through our advisory committees, and through communication at events. All of this is really important to us so that our program is matching the need of the people who work with us. So I'm really excited about our communication offerings. These are the 3 big ones, the big 3. So we have our internal newsletter that we call The Beat. And with that one, Erlnisha and I, our program assistant, she works super hard to make sure that we get these out pretty much every week. We start with an inspirational quote. We have what our team focus is for that week, upcoming announcements, things to keep in mind, deadlines that we have. So this really helps us keep organized and be on the same page as a team. And it's internal just for the RML. Then we have the Pulse newsletter. This one is monthly and it goes out on the 2nd of the month because we're Region 2. And pretty much this captures like our featured events for programming for the different subject areas that I described before. It lets you know where we'll be. So if we're going to be at like a major conference or something like that, we'll put that information in there so you can see it. There's ways to get in contact with us. Sometimes we'll have contests or other ways to get involved. So that's all available on the Pulse newsletter. And you can sign up for that if you like, if you're not already on it, which I highly recommend. Then we have our Pulse Digest. This one is a little bit more it's not as common, not as regular as the other 2 that have those standing send outs. This one is more of like once every few weeks, once every month or so, roughly. But basically in this, we just provide education and training opportunities to make sure that you know what's coming up. So instead of us sort of sending things on all the time with what's going on, we try to digest it and really distill it into this one newsletter that you get every once in a while so that you know what things are coming up, what things we want to support within the network and beyond, so that you know about those upcoming, things where you can get involved and learn more, extend your learning. So number 9, issues. These are things that we're all dealing with, right? So we have the grips of the pandemic still. There's added monkeypox concerns. We know that our members are really struggling with trusting systems. There's apathy in systems, political turmoil. I'm not telling you anything you don't know, right? So these are all the things that we're trying to focus on in our region together to better meet these needs for our membership. We know that all of these things, right, going back to the environmental determinants of health, impact the way people feel and what they need in terms of their health. So we want to make sure that we're connecting people with these resources, that we are aware of what's happening, that we are also feeling these things and these issues and want to support them as best as we can. All right, we made it to number 10. Thank you for coming through this with me. So there are different ways you can connect with us. There's our main website through the NNLM. We also have ways to connect with us on social media. So you can find us at that that handle, NNLM Region 2. And then also there's a way to sign up for our newsletter. I will drop the link to these slides in the chat so that you have them. And also I will take time for any questions. Thank you so much.
Thank you, Lorin. Does anyone have any questions for Lorin? I didn't see any in the chat box. One of the things that, Lorin, how, if people want to sign up for the newsletter, where should they go, or how should they go about doing that?
All right, thanks, Shannon, for that question. So I'm going to put the link to the slides there, and that will include the link for signing up for the newsletter. But there's also a separate link because we use MailChimp right now for the newsletter, and I'll add that too, just so you have it in the chat.
So if you have a question, you can put it in the chat box. And we will give Lorin a chance to answer your question. I see a fair number of health sciences librarians, so they may already know about the beauty of the NNLM. Tamara says, you probably stated this, but when does the next funding year begin?
Sure. Thank you, Tamara, for that question. So what I think will happen is that in the fall, we'll open up for some smaller grants again, because they mainly ended earlier this year. Like we had a few months where folks could apply. But I think we're going to do another round in the fall, like September or October. But officially, we'll open up in, I think, January for new grants. All of this will get sent out to everyone, but we might have some leftover funding. This is why I can't give you an exact date, because we might have leftover funding and we're planning on it from year one. And it'll be like a kickback to us in the fall. And we want to, provide that funding to our members, but it's not official yet because it hasn't come through. But either way, the winter is when we'll open up for the next funding cycle for sure. I hope that answers your question.
Well, and I think too, just to be clear too, is that that response or the answer may be different depending on the region, because everybody on the call is not in the southern region. So depending on there's 7 regional medical libraries. So depending on which region you are in, their funding cycle, they may have a different date if they're going to open up funding. So definitely connect with the RML in the region that you are connected to.
Yes, thank you, Shannon.
And Nancy had a question about, was there a directory of medical libraries in the region? And actually, there is, because if you go to Nancy, are you in our region? Are you in the South? Yes, you're in Georgia.
Georgia.
Excellent. Yeah. So let me get the link for you.
Thank you. Yes, and Nancy, that means that your point person would be Deanne. Georgia is her state liaison responsibility. So any questions you have, or if you're trying to figure it out, she's a good person to check in with.
So here's the, Nancy, here's the link. And what you have to do on that page is just filter it to, on the right-hand side, if you look down where it says filter the directory, just filter it by region 2, and then that'll just isolate out all of the libraries that are in the southern region.
Great. Thank you so much, Shannon. A couple things to add real quick. One, about Tamara's question regarding funding. It is never too early to get started. So even if, it feels a little bit difficult because we don't know like the timeline yet, it is never too early to start on the brainstorming on what you might want to do on refining your project. And we are happy to support you with that within our region. The other thing is like Shannon mentioned, it's kind of different depending on where you're located. So I know there might be some folks who are attending today who are not located in Region 2. You do have a region. So by going to that same website, nnlm.gov, you can find out where your home institution is located, and they will help you in the same way if you're interested in funding or finding out more information.
And here, there's the link to the different regions. So you can see the map. So you can see how the country is divided in terms of the region. Tamara says, will my liaison be able to tell me if my idea may or may not be fundable? Good question.
I'd say that depends. I think overall, yes, because we do provide that kind of support one-on-one to hear about your idea and where it might want to go. I mean, I feel like there might be only so far as we can take it as liaisons because it's a conflict of interest, you know, a little bit. But I think that we definitely want to workshop it with you, and we work with people to make them successful. So, for example, we had one sub-awardee that applied from one of our regions and was previously unsuccessful. Like, they were unsuccessful the first time with us. They didn't work with us. They just applied for funding. And then they wound up working a lot with members of our team. And then their application was approved and they were able to do their project. So I really feel like we're invested in making you successful, and we'll try our best. But there are probably some limits with, you know, making that happen. You want to add anything to that, Shannon?
Yeah, what I would say to that too is that because you know, even though the Region 2 office and all the offices are based at universities, the funding is through a federal mechanism, which means that there's transparency in who has been funded. And so I put in the chat box the list of past funded projects. And what that can do for you as you're thinking about the types of projects that have been funded. And we're in year 2 of a 5-year cycle. So if you go to that link, it'll show you some of the projects that have been funded across the network since they have things in here from 2016 to 2021. So you can look to see what types of projects were funded. But one of the good things, like Lorin said, is that our goal is to try to help you get funded. And so the team will work with you to improve your application. That's not a guarantee that it's going to be funded, but it is a, you know, help for you to try to submit the best project possible. And if we can't fund it this time, you may get feedback on how or what would make it eligible to be funded. Are there any other questions for Lorin? I think, and I think, Lorin, you did mention that, you know, one of the things that I think is pretty exciting is that we do have, so you can get funding to do an outreach project, but you also can get funding to go to a conference. So for professional development. So we have given out those types of awards. And I know before we became at RML, I think, you know, some years they're often begging people to apply for this funding. Now, there's the COVID effect, but when we send those messages out about apply for this funding for $1,500 so that you can go to somewhere like JCLC or to the South Carolina Library Association or whatever conference it is, and it does not have to be a library related conference, because the National Library of Medicine, I guess about 5 years ago, changed their name from the National Network of Libraries of Medicine to the network of the National Library of Medicine, because libraries are not our only members. They changed their name just to recognize the fact that libraries cannot be the only group working to fight health disparities, that we have to be in partnership with community organizations, so that we have a fair number of community organizations that are also members of the network too. And it just enriches that the experience of trying to work towards really strong outreach projects that have real strong partnership foundations. And so it's a good program. Like, we're excited. This is our first year. It was a very competitive process. And so we're excited to be the RML for the Southern region, and would love to engage with you all more. So, you know, if you do live in the South, make sure you're reaching out to the team and in conversation. That's whether you're applying for funding or if you're attending some of the professional development opportunities, because those opportunities are free to you. They're no charge for you to attend, and you get to learn some good information from a lot of really cool speakers. And what you'll notice if you go to the NNLM website and look at the training opportunities, these are training opportunities that are being offered all over the country. You're not limited to the South. You can't apply for funding from another RML, but you can attend training opportunities that they sponsor because they are national programs.